So in this session, let me discuss the multiple choice questions in the topic of the mitral stenosis. A 69-year-old woman is admitted to coronary care unit with unstable angina. She started on a appropriate medication to reduce her cardiac risk. So she is hypertensive and fasting blood glucose levels are normal. Cholesterol is 159 milligrams per deciliter. And she is found to be in a state of atrial fibrillation. And what is the most appropriate treatment that you need to give in this patient? So the options are the aspirin and as well as the clopidogrel, digoxin, cardioversion, aspirin alone, then the warfarin. So you take, how do we decide the treatment? I have discussed based on 𝐶2DS2 VAS scoring system, we decide whether to give antiplatelets or anticoagulants. So this 𝐶2DS2 VAS scoring system, this is what is your 𝐶2DS2 VAS scoring system. I have discussed this in the theory part also. So now what are all there in this patient? Let me take up one by one. So first and foremost, the age of the individual is 69 years. So if the age is in between 65 to 74, I said you that we need to take a score of 1. Female patient, you need to take another 1 point. Then the individual is having the unstable angina. That means vascular disease is there. Give a score of 1 point. And she is hypertensive. Hypertension, give a score of 1 point. Okay. And fasting blood glucose levels are normal. Cholesterol is 159. So in this patient, your 𝐶2DS2 scoring system is 4. So what is the treatment that you need to give in these patients? You need to give warfarin in these patients. Okay. So because what did I tell you? If the 𝐶2DS2 scoring VAS scoring system is more than or equal to 2, you need to start the anticoagulant, that is warfarin. And whenever you are giving this warfarin, the INR has to be maintained between 2 to 3. Okay. So that is about how to decide whether to give antiplatelet or not, or how to decide whether to give anticoagulant or not. Okay.